Good morning, everyone. This is Miss Nika May M. Ariola together with Miss Christine Sumera, and we are going to report substance-related and addictive disorders. So first, I will present to you the status quo in Philippines based from the Philippine Dangerous Drugs Board as reported um, on the Treatment and Rehabilitation Admission Information System. So far, meron tayong 5,227 cases admitted on rehabilitation facilities. So, hindi pa kasama dito yung bilang ng mga hindi na-admit sa rehabilitation facilities. So, maaaring napakalaking bilang pa ng mga may substance use disorder sa Pilipinas. So, 9:1 ang ratio of male to female with the youngest case of 7 years old and yung oldest ay 68 years old. So, nangunguna pa rin na substance na inaabuso sa Pilipinas ay ang shabu or the methamphetamine hydrochloride. Pumapangalawa ang marijuana or cannabis and the rugby or contact cement. So, moving forward, the substance use disorder. This is a disorder pertaining to use and uncontrolled use of a substance and pwedeng combination din ng substances na nag-i-interfere sa ating emotional, social, educational, and occupational functioning. So may tinatawag tayong substance intoxication. Kapag sinabi pong intoxication, there is a physiological reaction after ingesting a substance. So may iba't ibang biological reaction ang katawan ng isang tao sa isang substance. Pwedeng pag alcohol use, magiging drunk, or sa ibang substances, yung tinatawag na pagka-high. Tolerance naman is the term used para sa pagdami ng kinokonsume ng substance ng isang individual to get the desired effect. So, yung same amount ng substance na tinitake before ay hindi na nakapagbibigay ng same desirable effect sa isang individual. Kaya, larger amounts are needed. So, magiging tolerant na ang isang individual sa substance. For withdrawal naman po, the symptoms appear after the abstinence or yung paghinto ng pag-take ng substances. Dependence happens when a person is functioning normally lang kapag nandyan yung substance. So, it is manifested then with the presence of withdrawal symptoms. So, the following are the substances that are abused and are under the substance use-related disorders. So, nangunguna dyan, stimulants. Kaya nga stimulants from the word stimulate. It stimulates and elevates your mood. It provides euphoria, feelings of vigor, highness, and after pwedeng magkaroon ng crash. So, stimulants include amphetamines, cocaine, tobacco, and caffeine, yung isa sa most common stimulant na a-abuse natin. So, for this, mapapansin nyo, walang long line sa stimulants kasi for tobacco, wala siyang description of intoxication on the DSM-5. It only reduces stress and improves mood. Pero again, walang description of intoxication sa tobacco. For opioids naman, intoxication include decreased awareness or responsiveness, breathing problems, or extreme sleepiness. For cannabis and hallucinogens, medyo common and same sila ng intoxications kagaya ng perceptual changes, hallucinations, heightened sensory experiences. For depressants naman, kaya siya nandyan sa may bandang ibaba. So for us to remember that these are also called downers or it relaxes people. It provides sleepiness sa mga tao. It reduces anxiety. So kaya nga ang example ng depressants na alcohol, benzodiazepines, and barbiturates are most commonly used na pang-reduce ng anxiety. Barbiturates is also a substance na common na ginagamit for suicide, yung pag-overdose ng barbiturates. So, other drugs include inhalants, kagaya ng mga spray paint, gasoline, thinner, or pwede din yung steroids. For addictive disorder naman, yung gambling disorder, kasama siya dito kasi yung dependence, tolerance, and withdrawal symptoms niya ay similar sa substance-related disorders. So when it comes to withdrawal, mapapansin nyo yung hallucinogen ay hindi sakop ng circle kasi natatanging hallucinogen lamang yung walang reported case ng withdrawal symptoms. So for stimulants, pwedeng magkaroon ng depressed mood, apathy, prolonged periods of sleep. For opioids naman, excessive yawning, muscle aches, and diarrhea. For cannabis, pwedeng nagkaroon ng irritability and restlessness, which is exactly the same sa gambling disorder. For depressants naman, common ng anxiety, insomnia, and tremors. So furthermore, the causes of these substance use related disorders will be discussed by Miss Christine.
All right, thank you, Ma'am Nika. Okay, so now let's discuss the causes of a substance-related disorder. As we can see, there are several factors that are linked in the substance-related disorder. So we have biological dimension, psychological dimension, cognitive, cultural, integrative, and the other one, we have the social dimension. So first, let us tackle biological dimension. So as we can see here, biological dimension includes the family and genetic influence as well as the neurobiological influence. So according to research, particularly the research field of functional genomics, genetic factors may influence how people metabolize various drugs and also helps in identifying uh, whether who would become habitual users or not. So for this one, it also aids in determining what type of treatments is most beneficial for this particular disorder. So in other words, we can say that genetic predispositions can influence the person's vulnerability to substance-related disorder. So as for the neurobiological influence, it explains the activation of the so-called pleasure pathway. For this one, it includes the reaction of substances with different neurotransmitters in the brain. So the pleasure pathway activates the reward center and provide the user with pleasurable experiences at least for a time. Although these substances not only provide pleasurable experiences, it also helps remove unpleasant experiences. So now let's go to the psychological dimension. So this includes the theory of what we call as the opponent process theory, which is linked to positive reinforcement and negative reinforcement. So according to this theory, an increase in positive feelings will be likely followed by an increase in negative feelings of the user. So take for instance, after a substance user achieves his or her desired pleasure from taking that substance, he or she may experience a crash or the unpleasant experience after being high, and in some cases, blackout happens. So these unpleasant experiences tend to intensify as the individual's pleasurable experiences increases too. So according to studies, they believe that the best remedy for such case is just the same substance taken by the user. So now let's go to the cognitive dimension. We can see here the expectancy effect. So what is expectancy effect all about? So for this one, it impacts the cognitive dimension of the user. So when a person expect to be less inhibited, he or she will likely act less inhibited regardless of whether they consume alcohol or a placebo. So positive expectations of the user have an indirect effect on the drug problem as well. So these attitudes can raise the possibility of using specific substances, thus also raising the risk of developing a particular problem. So cravings can also be induced by the availability of the drug, interaction with someone who is using the substance, or having modest amounts of such drugs. So now let's go to the next dimension. So we have, wait a minute. we have the social dimension. So for this one, this includes the exposure of the user with his or her friends who affect their substance usage or through the use of media. So for instance, we have the peer influence. For this one, particularly among teens, so it has significant impact on substance usage. So it also happens for the media exposure. For instance, we have the cigarette advertisements. Okay, so cigarette taking or using. So in addition, neglect and lack of attention and care for children in a family with drug addicted parents causes them to become more dependent on classmates or friends who also abuse substances. So according to studies, traumas such as assault, military warfare, and natural catastrophes might also develop substance use disorders by acting as triggers for people's predispositions. So the cultural dimension, as we can see here, it includes the culture, beliefs, and traditions. So for this one, it examines how each culture has its own set of acceptable psychoactive drugs and its own set of substances that it considers inappropriate. So not only do cultural influences influence the prevalence of substance misuse, but they also dictate how it manifests. So the last one will be the integrative model. So for this one, it says or it believes that substance abuse or substance related disorders cannot be assessed solely but on the basis of a single dimension. So it will not only be about social or cultural or cognitive or biological, but it happens in a integrative approach or in explaining the causal factors of the substance related disorder. So now let's go to the treatments of the substance related disorder. So as we can see here, the principles of effective treatment includes 13 principles. So for this one, it says that there is no single treatment appropriate for all individuals, and an effective treatment attends to multiple needs of individuals, not solely or not only for his or her drug use. So furthermore, the individual who is being treated for the disorder should also is needed to remain for the treatment in at least 3 months or longer. So treatments includes counseling. So it can either be individual or group counseling. It also includes behavioral therapy such as the cognitive behavioral therapy, which targets the relapse prevention for the users. So the relapse prevention model help people examine their belief about the positive aspects of the drug and confront its negative aspects to remove ambivalence in stopping drug use. So as we can see here, medications are also important element of the treatment, and they can be used more effectively with the combination of these counseling and behavioral approaches. Okay, so Ma'am Nika will continue the discussion about the treatments.
So thank you, Miss Christine. So moving on, in treating substance use related disorders, may tinatawag tayong medical detoxification. So what does it mean? Medical detoxification, ibig sabihin, the body get rid of itself sa substance na meron sa katawan. So kung sa mga nagda-diet, nagdi-detox, tinatanggal yung toxins sa body na unhelpful para sa individual. In this case, yung substances ang tatanggalin natin sa sistema ng isang tao. But the medical detoxification is deemed to be or is presented to be just the first stage of treating substance use related disorder. So bakit? Dahil kailangan lagi may accompanying therapies or follow-up treatments. Hindi nyo matitreat ang substance use related disorder ng detoxification lang. Palaging may kasamang therapies and other ways of treatments. So kasama doon yung mga biological treatments. So may tinatawag tayo na agonist substitution. Ito yung pag-substitute sa addictive drug ng isang safe drug. So pwedeng sa heroin, may tinatawag tayo na methadone as a substitute. Or pwede din naman yung buprenorphine na nagbablock ng effect ng opiates. Also, yung nicotine or yung may mga substance use disorders, smokers, pinapresent sa kanila yung substance in a form of gum or patch, inhaler, or nasal spray. So may tinatawag din tayong antagonist drugs. It blocks naman or counteracts the effect of psychoactive drugs. So the most common antagonist drug for opiate is yung naltrexone. And ginagamit din yung tinatawag nating acomprosate for alcohol cravings. So it is also important to understand na ang isang tao na may substance use related disorder with comorbidity sa iba pang psychological disorders must be treated in an integrated way. So pareha siyang tinitreat. Hindi pwedeng psychological disorder lang or yung substance use lang. Kasi treating one disorder will not fully be effective kasi yung isang disorder ay pwede pa ring mag-cause or maging trigger sa substance use disorder. Also, it is important to understand and to remember na kadalasan na may mga substance use related disorder ay nakaka-acquire ng mga medical health conditions. So, kagaya ng may substance use disorder for tobacco. So, excessive yung pag-smoke or sa nicotine, excessive yung smoking. So, pwede silang magkaroon ng tuberculosis. So, para naman sa may mga substance use disorder for alcohol, pwede silang maging, dahil excessive ang use, pwedeng sexually active sa mga parties. So, pwede silang magkaroon ng HIV or AIDS or pwede din magkaroon ng mga hepatitis B and C. It is also important na tandaan na kapag nag-a-assess and nagtitreat ng substance use-related disorders, ina-assess din natin yung other medical health condition na pwedeng na-acquire nila. So, kasama yon sa treatment. Kasama siya sa kabuoang treatment. Also, ang treatment for substance use is a long process. Matagal siya, hindi siya madalian. So, pwedeng-pwedeng magkaroon ng relapse, pwedeng bumalik sa paggamit ng substance. Kaya nga dapat there is a continued monitoring. Dapat meron tayong parang chart for interventions and yung records, continuous ang monitoring dahil malaki ang chance na magkaroon ng relapse dahil sa sobrang tagal ng process ng substance use-related disorder treatments. So all in all, itong 13 principles ng effective treatment natin must be always adhered to. So siya ay sinuggest ng National Institute on Drug Abuse and ang dapat sundin natin in ways of treating substance use disorder. So that will be the end of our report. Thank you for listening.
Okay. If Okay, if I may add lang po, we can also use, aside from CBT, we have dialectical behavior therapy, assertive community treatment, therapeutic communities, contingency management, and exposure therapy for the treatment of substance-related disorder. Okay, so that will be all. Thank you so much. And a minute. Okay, thank you.